Good day, viewers. My name is Reverend Dr. Stanley Opochukwu priest of the Anglican Communion and medical doctor. This day, I want to bring you an interesting topic that I want to educate you on so that you know what to do. Recently, I've watched some videos on the internet and WhatsApp being shared on various groups where a surgery is being done on somebody and a lot of worms, bags of worms are brought out of the person's intestines. That's why I want to talk about worms today. Particularly of interest will be intestinal worms, the worms that affect the intestine or that affect the, the GIT, the gastrointestinal system. Um, what are these worms? There are types of worms. We have the flatworms and we have the roundworms. The flatworms, some of the examples include the tapeworm or the flukes, the tapeworm or the flukes. While the roundworms, you have the pinworm, the ascaris lumbricoides, or the hookworm, even the whipworm. Now, what happens? What does it mean when we say intestinal helminthiasis or intestinal worm infestation or parasitic worm infestation? Now, it simply means a person who coincidentally or by any means ingests or eats or takes in worms. These worms are listed, either the flat worms or the round worms, and take it into their mouth, down into their intestines, and they stay and reside in the intestine, now producing eggs. And over time, they may cause symptoms, starts causing symptoms for the person. That's what we call intestinal helminthiasis. It comes up with several symptoms. Now, what are these symptoms we're talking about? It could be abdominal pain, you start feeling pain in your tummy. It could be diarrhea, you start passing watery stool. Even the diarrhea can it could even be like dysentery, where you see blood in your stool, you see something like mucus. Yes, worms could give you that. It could just be vomiting or even nausea. Nausea, what we say nausea mean you are feeling like you want to vomit, but you eventually don't vomit. You could be feeling like your tummy is bloated, there's a gas in your tummy. Those are some of the symptoms. You could be feeling tired. When you do something simple, you feel tired. Um, you could also see when you pass through, you see frank live worms in your stool. It means you're actually infested. Or sometimes you start having itching in your anal region, your anus. You start having itching. You are itching. Sometimes you just feel itches. Yes, because the worms, sometimes even at night, you're feeling itching there. The worms are laying eggs down there and could be giving you itching, could be reacting and giving you itches. Another symptom is could be you may eventually happen what we call unexplained weight loss. You are losing weight. Maybe because there are worms so many inside preventing you from utilizing the nutrients you are eating. And particularly for children, because of that, it can prevent them from growing effectively. When you compare an 11-year-old child and another 11-year-old child, one is growing more than the other significantly. Maybe it could be because of worms. These symptoms are some of the symptoms of worms infestation. They could also be symptoms of any other disease. Now, how are these worms transmitted? I thought of types of worms. How are they transmitted? Generally, it's fecal-oral. You ingesting it, maybe from contaminated feces, you ingesting it. Now, it could be gotten from uncooked or poorly cooked beef or pork, like the Taenia solium gotten from pig, the Taenia saginata gotten from beef. Yes, if they're uncooked, you could get them. These are types of worm, Taenia solium, Taenia saginata, Taenia um, species generally. Now, you could also contract this worm. You could also be infested with worms if you drink water that has the larva or the eggs of these worms. If you drink them, they eventually produce. You could also get contaminated by, for children that likes playing in sandy areas. When they play in sand, if they play with sand that is infested or the sand that has this larva, they could ingest it, and eventually they come down with this worm infestation. Um, these are general ways you could contract it. Now, I want to talk about the how you prevent these worms. Now, I've told you how you contract it. Preventing it generally by sanitation. Make sure you wash your hands. There are moments of hand hygiene before you eat, after you go to the toilet, um, um, before handling food or before cooking. It's important. Then regularly, when you interact with people, shake somebody else, you wash your hands. There are moments of hand hygiene I'll talk about in another video. Now, what are the complications of worm infestation? One, it will give you anemia. Anemia simply means your blood level becoming lower than normal. Yeah, because sometimes when the worm attach on your intestines, they make the place bleed and they suck the blood and the blood. That's why you see blood in your feces. So it will give you anemia. So some people it could even give intestinal obstruction in severe cases. It prevents food from passing through the intestine successfully and going out through the anus. So you find it difficult to pass through. So like the patient in the video had intestinal obstruction, and that's why the patient had surgery. Then another complication could be malnutrition. Malnutrition. I talked about it earlier. A child not growing properly because of worms are there in his system. Talking about these worms, why are we talking about it? I told you earlier, over 1 billion persons in the world have the pinworm. Over 500 million has the hookworm. Over another 500 million has the whipworm. So a lot of persons in the world has this worm. So it's important we talk about it so that you could seek medical counseling when you have these symptoms. Now, how do we treat this worm infestation? It could be medical or surgical. For medical, there are what we call anti-helminthic drugs against worms that doctors will prescribe. It's also safe. Some of them are not safe in pregnancy, while some are safe in pregnancy for pregnant women who have worms. If you could meet your doctor, he will prescribe the accurate one. Then for children, they are calculated by dosages by per weight or by age. So you see your doctor, he will tell you the dose that is appropriate for you for treatment. Then if there's already intestinal obstruction, there could be surgery. There could be need for surgery as part of the treatment package for you. So those are the summary of what worms is all about. The child could be having it. Your sister behind you, please visit the hospital for deworming. The treatment is called deworming. You want to deworm yourself. Don't just go and buy any kind of drug, it may affect you. See your doctor. Finally, I want to invite everybody within the Okigwe South Senatorial Zone, or for Anglican, we call it the Okigwe South Diocese, comprising of Ituboma local government, Ehimembano, and Obo local government areas. We're inviting you to Ehimembano General Hospital. Just if you're coming from Oriago area, before the local government, there's a hospital by the left we call the Ehimembano General Hospital. On the 24th and 25th of this month, which is on a Tuesday and Wednesday, for a free medical outreach, 24th, 25th May 2022, for free medical outreach where we'll be deworming everybody that comes on that day. We'll deworm you, give you medications for one after the doctor would have seen you. If you have any reason to talk about any sickness that bothers you, you can still discuss with them and they will attend to you. We'll be running free vital signs check, blood pressure, heart rate, weight, height, temperature, all those things. We'll be checking free of charge for people to who come during that outreach. Now that outreach, we're calling it pre-synod outreach because the synod of Okigwe South Diocese is on the 26th through on the 26th through 29th of this month. So this month of May. So if you come on the 24th or 25th, we'll attend to you as the pre-synod package for this year's synod. Free medical outreach. I will also give you some health talks on that day for those who come around. You can ask any question you want, and the doctors will be available to attend to you. Thank you very much for watching this series. God bless you. I remain your friend, your brother, Reverend Dr. Stanley Okochukwu Okero. Bye bye.